Standard precautions are a set of guidelines that are designed to prevent the spread of infection by exposure to an individual or their bodily fluids. Which of the following is not considered a standard precaution? A. The use of alcohol-based gel after patient contact. B. The use of gloves when placing a peripheral intravenous line. C. The availability of appropriate and cleanly resuscitation equipment. D. Placing clients in private rooms. E. Disposal of used linens in designated areas. The answer is D. Placing clients in private rooms. Standard precautions should be utilized in the care of every patient. Hand hygiene before and after patient contact is always required. Clean, functioning equipment should always be available. The use of personal protective gear when there is potential to blood or bodily fluid exposure is critical. This includes the proper disposal of soiled materials such as linens. However, it is not necessary for patients to be housed in private rooms unless they are affected by an infectious disease. If private rooms for infectious individuals are unavailable, it is acceptable to place patients in cohorts of the same infectious disease. The nurse is caring for a patient with severe agoraphobia. What area of the hospital should the nurse avoid with the patient? A. Areas with lots of people. B. Areas with lots of needles. C. Enclosed areas. D. Wide open spaces. The answer is D. Wide open spaces. A patient with agoraphobia has a fear of wide open spaces. A 4-year-old child is admitted to the hospital after his family was in a car crash, where his parents died. The child keeps asking you to bring his parents back to life. The nurse knows that. A. The child is delusional and may have suffered a concussion as a result of the crash. B. The child has not seen a person die before. C. The child is depressed. D. This is a normal reaction. The answer is D. This is a normal reaction. This is a normal reaction for a young child, who may not fully understand death. These requests are not necessarily indicative of delusion or depression. When reviewing a client's chart, the nurse sees that the doctor identified that the client is experiencing a situational crisis. An event that could cause this is A. Retirement. B. Child abuse. C. Rape. D. Abortion. The answer is D. Abortion. Abortion is a common cause of a situational crisis. Retirement may cause a maturation crisis, and child abuse and rape may cause an adventitious crisis. The nurse is caring for a patient with severe agoraphobia. What area of the hospital should the nurse avoid with the patient? A. Areas with lots of needles. B. Areas with exposed levels, such as balconies. C. Wide open spaces. D. Enclosed areas. The answer is B. Areas with exposed levels, such as balconies. A patient with agoraphobia has a fear of heights, thus exposure to exposed levels or other significant drop-offs will scare the patient. A patient is seeking an herbal solution that produces an effect similar to estrogen. What herb should the nurse suggest the patient investigate? A. Cat's claw. B. Black cohosh. C. Feverfew. D. Milk thistle. The answer is B. Black cohosh. Black cohosh produces effects similar to those of estrogen. The patient is curious about behavior therapy, and asks the nurse. The nurse would best describe behavior therapy as A. A therapy that makes use of physical and social environments. B. A therapy that makes use of a group dynamic. C. A therapy that achieves results through conditioning. D. A therapy that makes use of relationships and personal connection. The answer is C. A therapy that achieves results through conditioning. Behavior therapy is a therapy that achieves results through conditioning. The therapy aims to reinforce desired behaviors and eliminate undesired behaviors. A patient is seeking an herbal solution that improves microcirculation in the eyes. What herb should the nurse suggest the patient investigate? A. DHEA. B. Peppermint oil. C. Bilberry. D. Aloe. The answer is C. Bilberry. Bilberry improves microcirculation in the eyes. Which of the following herbs aids in wound healing when applied topically? A. Red raspberry leaf, Robusta ius. B. Hawthorn berry, Crocus ssp. C. Yellow dock, Rumex crispus. D. Calendula flower, Calendula officinalis. The answer is D. Calendula flower, Calendula officinalis. Calendula flower contains fardiola, the fardiol monaster, powerful anti-inflammatory and anti-edematous tritopanoids, which have shown effects comparable to indomethacin. Yellow dock is as a laxative. Red raspberry leaf is a vasodilator, and may exacerbate inflammation. Hawthorn berry can be used to ameliorate symptoms of congestive heart failure. Which of the following herbs contains a compound similar to lovastatin? A. Nettle, Urticularia. B. Kava, Piper methisticum. C. Red yeast rice, Meniscus purpuris. D. Lavender, Lavandula. The answer is C. Red yeast rice, Meniscus purpuris. Red yeast rice contains monocolins, which block the production of cholesterol. Monocolin K has the same structure as lovastatin and functions similarly to reduce cholesterol. Nettle is best used as a painkiller, and to treat disorders of the excretory system. Kava is a sedative and anesthetic, and may also be used to treat social anxiety. Lavender has a calming effect, and is effective in inducing sleep.